The following flaws were found in regard to the current QAS policy regarding incidences of child maltreatment. There was not enough clarity surrounding a paramedic's approach, specifically in regard to lack of information on children exposed to domestic violence. The current approach requires interpretation of indicators which can be influenced by unconscious bias and responders' experience in handling CEDV cases. These factors can increase the chances of vulnerable individuals to be overlooked. Paramedics are to only practice within their scope of knowledge and authorization, so without specific policy, they may not act due to fear of breaching the QAS policies. Hence, it can be suggested that due to the lack of information provided to paramedics on handling CEDV, a subsequent absence of response to these individuals is consequated. The Child Protection Act, Section 13E, legally makes specific health professionals mandatory reporters on child maltreatment. In Queensland, unlike other jurisdictions, paramedics are not explicitly mentioned as mandatory reporters, although Section 13A states that any person may inform. It has been found that this exclusion of paramedics as mandatory reporters can lead to a misfounded belief that paramedics are not permitted to report in child maltreatment and CEDV cases. It is apparent that there is room for improvement in the current response. This can be achieved by provisioning policy changes to provide paramedics clearer guidelines in responding to child maltreatment, especially with the inclusion of CEDV. Hence, the following strategies are recommended in line with the current guidelines. Mandatory training can aid in the response in these situations by enhancing recognition of the signs of child maltreatment, understanding of legal responsibilities, and the reporting processes to empower responders and reduce barriers to action. The implementation of training workshops for QAS paramedics on a yearly basis can achieve maintenance of knowledge, with the use of a pre-hospital emergency services adapted version of the Child Abuse and Neglect Education Model by Queensland Health. Applying a process and patient assessments for paramedics to inquire about domestic violence and CEDV when it is suspected on scene will help sensitize paramedics to the consequences of domestic violence and provide criteria on reporting, and also provide early intervention opportunities, especially in the circumstances where patients are not transported to hospital.
Created using Powtoon.